With all of our digital health services now available at every location, from video visits to e-check-in to our app, you may notice that even your in-person visits are a bit more modern. A new experience for our new normal. We're here to keep your health on track, in person or virtually. And we're moving forward, together.
Hi, everyone. I'm Nikki M. James. Welcome to my home office, and welcome to the second episode of Healthcare Heroes, which is a collaboration between Playbill.com and Weill Cornell Medical Center. So we're going to be focusing on getting through and staying safe during COVID-19 pandemic. We're going to have two primary care physicians from Weill Cornell on with us. They're going to answer my questions. They're going to answer your questions. And we're going to get, an idea of what the intersection is between health, wellness, and of course, theater. So why don't we get started? First, I'm going to introduce Dr. Moitri Savard. Dr. Savard is the medical director for Weill Cornell Medicine, primary care in Long Island City here in New York City. Her practice includes adult medicine, women's health, pediatric care. She was recently on Weill Cornell's Medical Back to Health podcast, so she has a lot of experience doing this kind of stuff. I'm new to this, so maybe Dr. Savard, you can lead the way and help me get through. When she was answering most common questions about COVID-19 and what people can do at home in terms of self-care during this time. Welcome, Dr. Savard. So nice to meet you here.
Thank you so much. Happy to be here.
Absolutely. And next we have Dr. Paul Fenyves, who is an internist, and he provides comprehensive primary care to his patients. He's the Associate Director of Digital Care. That's an important thing that we'll touch on today. And innovation for primary care at Weill Cornell Medicine. And he played a major role in digitally managing outpatients during the rise of the COVID-19 pandemic. Welcome, Dr. Fenyves.
Thank you so much. Great to be here.
Good. Can we go with first names for this thing? So we can pretend we're old friends. It's so exciting to have you guys here today, the two of you, some experts to answer some of my questions. It's a really stressful time in the world. And I love that what we're going to focus on right now is COVID-19. We'll answer all the questions we have about that, but also what we should be doing for our primary care, our ongoing care, what precautions we should be taking, what should we be keeping up with, what we can do at home, how we can be in touch with our doctors to take care of our whole body, inside, outside, even if we're not suffering from the coronavirus. Mm-hmm. So, but let's start with some COVID-19 questions, if you don't mind.
Sure.
I would love to know about what kind of testing there is available at this point in the pandemic, both here in New York, which is our expertise, but hopefully elsewhere in the country. And what do the different results mean for someone's health and safety?
Thank you so much, Nikki, again, for having us here. This is a really important question because there are a lot of tests out there and you have to really know what you're getting. To find out if you have COVID-19, there are antigen tests and PCR tests. Antigen tests were like the early tests that people heard about, where you can get a test with a result within minutes. Those tests are actually looking for the virus itself. The more common test now, because it is more accurate, is actually a PCR test. That test is looking for the genetic material of the virus. And that is, more common right now. The results can take a few days to, depending on where you are in the country, can take up to 7 to 10 days.
Wow.
There have been some problems with reagents and the materials needed to produce those tests. So those are the primary tests that we have available to us in this country. We also have antibody testing. What antibody testing shows is whether or not you've been exposed to the virus. The problem is, and you would want to do that a couple of weeks after a potential exposure to really have the antibodies, have time to show up. The issue is we don't know what the antibodies mean. We don't know the significance. We don't know if they afford a protection during the season. So you still have to socially distance and wear a mask and all the fun things that we've been doing for months.
Yeah. And so if you're going in, for example, for the COVID test, the PCR test, that is what I've heard, and I've actually experienced it. That is the nasal swab test, is it not? Yeah. So can you just talk about how scary or not scary that test is, in case someone is feeling anxious about the test itself? What can we expect going into the doctor's office? Do I get a second to breathe? Are they just going to shove it in my nose? What's that process like?
So they absolutely give you time. It is not the most comfortable test because they really do have to get the swab pretty far back, but there's nothing to be afraid of. It's, the worst thing that happens, usually patients will sneeze or tear a little bit. The person giving you the test will be in full PPE, because a sneeze is actually a common thing to happen, right after the test. So it's nothing anybody should be afraid of. It's a little uncomfortable, but it's fast.
Great. That's really great to know. And then, and you did mention the antibody test, and I want to reiterate or just sort of go a little bit further about what you said about what the antibody test means or doesn't mean. So I was exposed to the virus. My husband tested positive early on in March, and we did all the things that people are supposed to do. In our apartment in New York City, I don't think we crossed even to take our garbage to the trash chute for about 3.5 weeks. Afterwards, we both went for antibody tests. He tested positive and I tested negative. So that was pretty surprising, given we live in a pretty small space. He's like off someplace in a closet right now, hiding from me while we do this little conversation. But after his positive antibody test, we didn't actually change a single thing about our behavior. We still do masks and all those things. And that is probably the best course of action for anybody, whether they have been exposed or have recovered from the virus. Is that true?
Absolutely. It's essential because we don't know what those antibodies signify. We don't know how long they last. We don't know if they afford any protection. So you have to be, doing everything you were doing before the test. It just gives some people some knowledge that, that was COVID that I had. And that's how we're using it right now.
Absolutely. That's both scary and good to know a little bit. Sorry to say, because uncertainty is one of the things that's the most stressful thing about this time. So we're grateful to have you guys here to sort of maybe alleviate some of those fears. So let's move on a little bit from the COVID vaccine or virus, and let's talk about what we can do aside from that. So maybe Dr. Paul, we're going with first names. If you could maybe speak to a little bit about what would be important about continuing to see our primary care physicians during this time, why that might be an important thing to keep up.
Well, thank you, Nikki, so much. So as a primary care doctor, not surprisingly, I think it is so important that everybody has a primary care doctor. This is your medical home. This is the person who you form a long-lasting relationship and a partnership to really achieve excellent health. And it's always important. Your primary care doctor is sort of the quarterback for your medical team. It's the person generally most focused on preventive care and making sure that you are maximizing your health today to prevent complications or problems in the future. So this is always so important. It's always important to screen for chronic illnesses, to screen for chronic diseases. I think in the time of COVID-19, it's even more important. As everybody I'm sure has heard, it's come to light that the risk factor for complicated COVID-19 goes up tremendously in people who have certain chronic conditions like hypertension and diabetes, and having these conditions controlled can mitigate some of that risk. So if you don't have a primary care doctor right now, I strongly encourage you to reach out to Weill Cornell and find yourself we have a wonderful crew of primary care doctors, and get screened. An opportunity to get a checkup, assess your cholesterol, assess your blood pressure, assess your risk factors, your risk for diabetes, and and of course, if you have any of these, or if you have sort of numbers that are off, or tendencies towards this, you can take steps now to mitigate that and help reduce some of the risks that they imply.
And also, I think we should, I want to just say, there was a time sort of earlier on during the pandemic when we were heard, to sort of not go unless it was necessary. But we're saying now that our primary care physicians and all the physicians at Weill Cornell and other medical centers are taking all of the precautions, that just being in the facility is not a risk factor, as long as you are not feeling actively sick. Are there other ways, instead of in-person visits, to be in touch with our primary care physicians, to coordinate sort of, conversations between your primary care and maybe a specialist or an internist that you have to see? What other options do patients have right now?
So absolutely, although I want to linger on what you had just said before. So 100%, if you haven't had any in-person visits, or you need to have an in-person visit in New York City, especially now, 100% is the time. And, there's two factors that are important to keep in mind. First of all, thank God right now, the prevalence in the greater New York City area is quite low. So as you pass people in the street, as you travel to your appointment, when you're in the office, just statistically, the chance that anybody that you encounter has coronavirus right now, thankfully, is very low. So that's number one. And then number two, our offices are taking tremendous precautions to try and keep people as safe as possible. So, for example, in our offices, we've reduced the number of doctors that are seeing patients by half. So just that alone reduces by 50% the volume of people who are in the office. And this allows us to have fantastic social distancing in the office, bring people very quickly back, generally straight from the entryway back into a room. So they're really not mingling that much. We're doing our best to make sure that hygiene is perfect and the rooms are being cleaned meticulously, and the appropriate amount of time is wait between patients. So basically, we're doing everything we can to make the experience as safe as possible. That, coupled with the low prevalence right now, means that it's a very good time to take care of all the care that people have been delaying.
Sure.
As far as other non-physical, non-office visits, COVID-19 has been fantastic for video visits. And if there's a silver lining to the pandemic, and particularly in New York City, it has been a tremendous explosion in growth in our video visit, our telehealth capacity. And before the pandemic, video visits were an up and coming thing. They were all the rage, and there was a lot of buzz around them. But a lot of doctors were reticent to try them, and a lot of patients were unfamiliar and reticent to try them. And the pandemic was a forcing function. It unfortunately forced a lot of people to seek their care by telemedicine, by video visits, and it forced many doctors to do the same, to provide care by video visits. And lo and behold, the doctors found that they can provide fantastic care, not for everything, but for many things. I'd say for most things by video visit. And the patients saw that they could be well cared for in an incredibly convenient setting.
Sure. That's so important.
Props really quickly, Nikki, to Paul, because he ran a lot of the video visits, like organizing the whole program, and it was amazing how quickly Cornell was, able to ramp up. And so when Paul is in the office, we have other doctors at home, the other half, to maintain distance, doing all the video visits at home. So we still have amazing access right now. And so this is time.
Yeah, so this isn't reducing the number of people. Reducing your in-office staff by 50% has no way limited your access of your patients. So you're finding other ways to reach out to them so that as many people as need to have visits for whatever reason can get an appointment quickly without much delay. That's a really important thing. And what is but then let me ask this other little question, which is not which is, I have a list of questions here that I put together, but this just brings to mind, what about confidentiality and safety over the internet with the televisits? So can we just say to people out there who are listening, what the safety precautions are? Do they need to be worried about someone overhearing or their information being out in the World Wide Web? I'm assuming the answer is no, but let's just, sort of say, give one more, sense of security there.
Yeah, so there really is tremendous security around video visits. So any doctor who provides a video visit has to use what's called a HIPAA compliant platform. So it means that it complies with the rigorous rules, security rules surrounding providing digital care. And so we're really talking about top-notch digital security. But another factor is just the nature of it being a real-time visit. So there's always security concerns with the internet. There's a bigger concern for static information that's warehoused in a particular place. The idea that someone would be able to hack in to your particular interaction at the time that it's happening is much less likely. So there's something about the nature of a real-time interaction that makes it much safer as well.
So these visits are not recorded or stored anywhere. It is actually real time, sort of like I'm talking to you now, and our conversation will be stored on YouTube so that people can visit later. But if we were in a real doctor's visit, it would be what this is, and then when we both signed off, that would be the end of that transmission. That's really good to know.
Yeah, the visit is not recorded.
We're not posting anything on YouTube from our.
I can imagine that wouldn't go over well. I don't know how many how many likes you would get on the YouTube channel. I just want to remind anybody who's out there watching on YouTube or the live feed, you guys can add any questions you want into that chat. They will get to me and I will get them to our esteemed guests. So we talked a lot about sort of what we can do doctor-wise and with visits. Let's talk about the fact that it is summer, it's hot, it's New York City. We are spending a lot of time outside, which is what's been recommended especially during this pandemic. So what are some examples that you could give of summer activities, and how high or low risk might these things be? For example, playing tennis versus playing, I don't know, one-on-one basketball with someone you've not been in contact with. What precautions could we be taking to enjoy outside while we have it, while also staying safe?
So, it really does differ sport to sport. Let's get to sports in a second. Go to the beach. The beach is wonderful. You can actually be socially distanced from other people. There's a great breeze. So that's always a wonderful, summertime activity. Maybe avoid the really crowded beach bar while you're there. The sports, tennis, if you're playing one-on-one with somebody, you're actually quite far away. So if you think about common sense precautions, maybe one-on-one basketball, you're a little bit closer, so that's kind of a tougher one to do. Take a bike ride. A bike ride is wonderful. You are able to be you have to be somewhat distanced from people, else you're going to have a collision. So something like that is a wonderful summertime activity. But we really do recommend people getting out right now. Thankfully, our numbers in New York are low at the moment. And take advantage of it because, and take advantage of this time to go out and get your doctor's visits. We anticipate, as things get cold in the fall, it will definitely be harder. It will be harder to come to the office with public transportation, and it'll be cold outside. So, and we do anticipate numbers going up when it's colder. And I see that Roberto has a question about this. He's got a picnic on Sunday and he doesn't have access to car. Which is better, taking an Uber, which may or may not have a plastic screening versus public transport, train plus bus. So this is a tough one, right? Because some public transport can be quite crowded. So maybe you get a sense of, I was on the subway recently and it was empty. It was quite easy. And this was like during a busy time on the 7 train where everybody had their mask on and people were socially distanced. So Roberto, if you get a chance to figure out how crowded these routes are going to be, that's ideal. If you're going to be in an Uber, maybe consider keeping the windows open. Have a mask on, and you can also get plastic shields, to cover your face as well. So that would be the safest way. So really, it's whatever you can do to get yourself out to the picnic.
Great. So, I guess wait for the next train, sort of let one pass if it feels a little bit crowded. I did want to ask, we brought up masks briefly. I'm taking a little divergent here, taking a little sidetrack. As far as masks are concerned, you guys wear hospital grade PPE when you're at work. When you are out and about, going to the supermarket, taking a walk, enjoying a summer afternoon, what are you using that anyone at home can easily have access to that's not wildly expensive or costs $10,000 on eBay? What should we be looking for as it relates to our face coverings?
So, Paul, can I start that?
Yeah, when I'm at work, I'm obviously using the hospital grade PPE, like you said. When I'm outside and when I'm out in the office, if I'm in public, I'm always outside. That's the biggest protection, is just being outside and being distant from people. I don't walk around with a surgical mask. I feel like I've got this piece of plastic over my face for 8 hours a day, 5 days a week. And so when I'm in the weekend and I'm in a less, a sort of a lower risk setting of being outside, I wear a cotton mask. And it's comfortable, it's breathable, it provides, I think, adequate protection given the current risk level of low virus and being outside.
Yep, right. I agree. I do the same. And, they looked at some of these studies in terms of which kind of masks actually work. And as long as it's a thick fabric or a couple of layers of fabric, which is what I wear, it's great. What we don't love are the pretty little shawls or the little cowl necks, because if you can see through that fabric, the virus can get in. Yeah, so, sure. The cloth masks are great. Just make sure that there are a couple of layers there, or that it is a thick enough fabric. You can put it to the light. If you can see through it, maybe it's not the best mask.
Sure, that makes a lot of sense. Also, it's like an opportunity to have one additional piece of fashion. I have so many masks. I wash them, I hang them. I have friends. My friend Colin Hanlon, who's an incredible Broadway actor and a film actor, he and his mom started a mask making company, Mask by Terry. I'm not being paid for saying that. They're my favorite masks. So that's an opportunity to sort of show your flair to the world and also send a message to people, right? Me wearing a mask in public or at the supermarket is sending a message that I'm being safe, so that you can feel safe. Sort of that is just reminding us that the virus is still present and that we're doing right things. So let's move on a little bit to some stuff for performers. There is no theater in a lot of places. There's no theater, but what do you think performers could be doing to maintain safety and keeping up their preventive care at this time so that they can remain healthy? Just some for performers and for anyone else out there, little tips, if you have any.
So general things that everyone should do, including performers, are hand washing, maintaining social distance, wearing a mask. Then you've got your personal care, taking care of your preventive visits, making sure your blood pressure is under control, getting a good night's sleep, making sure your stress is being managed. These are things that actually, impact your immune system. So those are essential for everyone. Regarding specific performances, it's, we were Dr. Fenyves, Paul and I were talking about how it would be lovely to have outdoor performances and ways where people can, be socially distanced while they watch a performance. It would be amazing if you had a playwright write a socially distanced play or a musical. So, it's a tough thing right now. And I've actually seen some performances online, as has Paul, right, Paul?
Yeah. So one thing we were saying, and I know a lot of people have commented on this. There were so many people who saw Hamilton in the theater and then saw it on Disney Plus, and a lot of the feedback is that it's like a complimentary experience, because when you see it live, you see there's the excitement of a live performance and being sort of part of it. But when you see it on the screen, you're really up close and you get those facial expressions, you get the real acting, and there's a richness to it that you don't get when you're in a theater. So, I don't want to sugarcoat it too much. It's really a terrible thing that our theaters are closed down right now. But, for God willing, this will be a very short-lived experience. And during this experience, if it's a chance to force us to be a little bit more creative, to try different modes and different mediums, and you might find that there are certain advantages, again, like to the facial expressions, of being in a different medium.
Yeah, I found that I participated with a group of actors in June, and we did our version of socially distant drive-in devised theater in upstate New York, where our audience came in cars. We performed outside, and our audience came in cars and watched most of our performance sort of driving around this little town. I found that it was incredible, and we had a primary care physician who was advising us on self-isolating before we arrived, because we were actually in some close contact with each other. We were tested for COVID both before we arrived and while we were there working together. We quarantined together. We ate our meals together. It was like magical theater summer camp. And we found that the people are, with performers, doctors, all of us are finding ways to improvise. We're trying to do the thing we do best under these circumstances, to give people care, and on my side, to continue to bring people joy. So I think that self-care, just like finding ways to not just bemoan our current state and find as a way, as an opportunity to be creative. I love that you brought up the uptick in telemedicine. That is an upside of this pretty terrible pandemic, is that we've now found another way. Going forward, there will be people who are maybe infirm, or who can't get on the subway, or have trouble getting up and down stairs. Like, this will be a way for people to keep up their connections with their doctors. So that's really amazing.
Without a doubt. One of the huge benefits of doing video visits during the pandemic was that we could care for somebody who potentially or probably had coronavirus without obligating them to ride the subway and get everybody sick, and then sit in the waiting room, maybe next to a young pregnant woman, and get her sick. And so it was a way to prevent the spread of the illness. And, and it makes you think, well, why are we not doing this every year with influenza? There's, so many young, healthy people who come to the doctor's office and get a diagnosis from Dr. Savard that they have the flu, and, go home and take some Tylenol and, have a good night's sleep. But in the meantime, how many people did they encounter on the way to their visit, and further the spread of the flu, which is, an epidemic we deal with every year. So, hopefully this will change for the better a lot of our medical patterns.
I certainly wash my hands much differently, and I always wash my hands, but I'm so much more cautious and thoughtful about how often, what I touch, when I enter my home. So I have another question here. This is from Daniel. He's going back to the mask question, the reusable masks, and actually this is something that I would love to know the answer to. His question is, how often should one be washing the reusable mask?
Well, so let's say you're actually out all day, using it for 8 hours. I think it would make sense to have another one and wash the one that you were out in all day, because if you think about it, it was quite a lot of exposure. If you've just gone out for a quick thing and not had a lot of contact with people, could you wear that same one the next day without washing it? Absolutely. I think that would be cool.
And to that point, surfaces. In the beginning of this virus, there was some about the pandemic here. There were some questions about, of course, there was always, should we wear masks or should we not? We're come to the point where the masks do much more good than any amount of harm they could have ever done. So we're pro-mask, everyone, wear a mask. What about touching surfaces? Should we be wearing gloves? How cautious should we be, for example, at the supermarket? Now that stores are open, people are eating outdoor dining. Should we be using only single-use utensils? Things like that. What is the lifespan? Do we have any idea of what the lifespan of the virus is on surfaces?
So there are these things called fomites, and they are on surfaces. The important thing to know is, some people feel more comfortable wearing gloves when they go to the supermarket. Some people are not. The most essential thing is to wash your hands after. If you're doing happy birthday twice with some, water and like not touching your face beforehand, then that is the best thing that you can do. So it's not like, just touching it, for example, and then, all of a sudden you have it. You have to, touch a mucous membrane too. So some people are wearing gloves to remind themselves not to touch their face.
Sure.
That's an interesting thing, because that doesn't make sense to me. But either way, you washing your hands, happy birthday twice, you're good.
And what is your feeling on either of you on hand sanitizer when soap is not available? Is it a substitute, or is it just next best thing? Washing your hands is the best option.
Yeah, it's definitely the next best thing. I would say two things about it. Number one, washing your hands with plain soap and water is probably more effective. Assuming that you're doing it right, you're doing the double happy birthday, and you're getting a really good lather, and you're making sure you've got a good technique that all of the surfaces are taken care of. But it's also healthier. So these hand sanitizers, I use them a ton in the office for convenience. Just because I have to wash my hands when I walk into the room with a patient, after I'm done typing at the computer, before I examine them, and then when I leave. And so it's like at least 3 hand washes. And if I was just doing happy birthday twice, 3 times, that would be the whole visit would be just hand so I'm stuck with hand sanitizer. But the long-term health implications of the sanitizers are unknown. There's definitely this idea of there being healthy bacteria on your skin, for example, and that
Right.
The hand sanitizers and a lot of cleaning products will sort of boast that they kill 99.9% of bacteria, and in terms of people's long-term health, that's probably not a good thing. So we want to get rid of pathogens, but we do not want to wipe clean all of the microbiome from our hands and from other surfaces.
Sure. Great. Oh, I love this. I'm learning so many things. I hope everyone at home is learning things too. You guys can add in your questions, reminding you to do that. You can type them on the chat and I will get them. So let's go back to sort of our ongoing care and visiting our primary care physicians and as it relates to COVID-19. We talked about this a little bit earlier, but I want to know why it is important to not delay care during this pandemic. And what are things that you should what are warning signs, either related to the virus or not, that say, this is a time where you should be calling your doctor. This is a time you should be reaching out for help. What are the risks of waiting for this to pass in order to reach out to your medical professional?
So the important thing is there are conditions such as hypertension, asthma, that can actually make you higher risk for COVID. So you don't want to let those things go, because if you have uncontrolled hypertension, asthma, that, where you're constantly inflamed and wheezing, you're more likely to, actually have a bad outcome if you were to get COVID. So shortness of breath, unfortunately, hypertension, you wouldn't know. This is why you really do have to go see your primary care doctor. And frankly, the best time to go is when you feel well. Right. So that you've set up that relationship, and then you've gone away to Connecticut for the weekend and something's coming up, you have that connection with somebody who has your history, and you just call up and do this kind of a digital visit with them to really kind of assess what your risk factors are, and could this be something more serious? So as much as possible, get a baseline as soon as possible.
Absolutely. Yeah. And that includes just, annual visits, annual checkups, That's really important. And what are the sort of things we should be looking for in those annual visits? If we're doing a workup with a primary care physician, what are the things that we can expect to be tested? What are the questions we should be asking of them for our own information? And what can we expect to be asked of us by, if you haven't been for a physical in a long time? And I would like to say specifically, Moitri, just for general, and also because I read that, you do a lot of women's health. So there are some stuff that women need to remember to keep check up. If you can touch on that too, specifically for females.
Sure. So Pap smears, it's cancer screening. You don't want to delay that, as particularly if you've had abnormal Paps in the past. That is something that needs to be checked. Mammograms. Again, there's been some debate about how often to do these mammograms, but again, really essential cancer screening for women. And Paul, maybe you can go through some of the other basics that we do for men and women.
Sure. Doctors, we're creatures of habit, and if you go in for any visit, particularly a physical, an annual wellness visit, there's generally like a very well-programmed sort of course that we run through. So we're going to run through your past medical history. So we want to know what are the things that have affected you in the past, which could be ongoing issues or could be clues to things that you're at risk of in the future. We're going to review your family history. Obviously there are many illnesses that tend to run in families, and if unfortunately both your mother and your father have diabetes, that greatly increases your risk of developing diabetes yourself. So a careful family history is going to guide where we're going to focus our attention, or if you're due for more aggressive or earlier screening for a particular condition. We're going to go over your social history. So we want to make sure that you've got the right habits that are going to maximize your health. So, ensuring that you don't smoke, ensuring that you drink in a responsible manner, ensuring that you're active and your sleep is good. And then there's a set of screening exams that are typically part of a physical exam. Some of these have to do with age. So determining if you're due for some age-appropriate cancer screening. So colon cancer screening with a colonoscopy, like Moitri said, if you're due for a Pap smear or a mammogram for breast cancer screening, PSA, which is the prostate number, and then assessing some different vital signs. So screening for hypertension by checking your blood pressure, doing some blood work to check your cholesterol and your blood sugar to screen for diabetes. So those are sort of the typical things that will happen in an annual physical.
Can I ask you a personal question? Why do they always make you get on the scale? Every time they're like, get on the scale, I'm like, no, because I'm terrified every time. Don't tell me. I say, I turn my back to it. So that's just like totally a silly question, but I really want to know, like, what are we looking for? Is it weight gain over years? Is it, what are they looking for when they're asking for your weight?
We're looking for multiple things, including weight gain over time, but also BMI. It is not like the perfect way to check a BMI, which is body mass index. And that really kind of gives us a sense of, like, are you overweight? Are you obese? Should we be thinking about having you speak to a nutritionist to come up with a weight loss plan? So that's one of the most important reasons. And I've had patients just say, just don't tell me, but it is important for us to have you get on the scale.
Okay, well, I'll do it. I mean, I really have been like, I weighed myself this morning. I weigh, and then I just make up a number. I guess as a bad habit as an actor, it's like a question they ask you often, your height and your weight. And this is a little secret story about me, is for a very long time, I would just say that I was 5'4", and I really believed I was. I said it so many times, it was a lie. I got measured for a physical, and the doctor was writing it down, and she said 5'3", and I was like, oh, no. Let me just do that again. She's like, you're not 5'4". I don't know why you've been telling yourself. Yeah. So, it's a lot of truth talking in that doctor's office. So that's really a silly little story to share. But the other thing, we have a few more questions, and we'll probably be, another 10 minutes or so. So get those questions in. I want to talk a little bit about vaccines. this potential for a COVID-19 vaccine, sure. Would love to hear what your thoughts are on that. But also about flu vaccines. That's something that actors get every year when we're working in theaters, and also the other vaccines that one could get over the lifetime. And if you could talk just a little bit about their safety, you know, what the studies are, whether or not one should be worried about receiving vaccines and what the benefits are for both an individual and, you know, as a community.
Sure. So first of all, flu vaccines are huge. Everybody should get your flu vaccine. You should get your flu vaccine every year. And if there was ever a year to get a first flu vaccine for anybody who's been dragging their feet, this is definitely the year. Hopefully coronavirus won't come back, but there is an expectation that the prevalence will rise, and you could really imagine a very nasty brew of seasonal influenza and coronavirus running around at the same time. And so if you have an opportunity to lower your risk of one of those viruses with a flu shot, that's a huge part of prevention. And so I strongly recommend that. In terms of vaccines in general, you know, it's interesting, before coronavirus and all of this race for a vaccine, I think the general public was not aware at just how difficult the vaccine development process is. But I'm sure many of you guys have heard these stories already, these reports that a vaccine from start to finish, we're talking about a decade-long development process. It is an incredibly rigorous scientific enterprise, from identifying the right candidate to going through 1, 2, and 3 phases of efficacy and safety trials. So these vaccines are really put through the ringer. And before you're the first person to get a new vaccine, that vaccine has gone through tremendous safety measures, and it's been given to a large number of, you know, very gracious volunteers who have taken it before you. So vaccines are safe and effective, and they're one of the most important preventive tools we have in medicine.
Right, and you can get a flu shot, just for anybody who maybe doesn't know, at your primary care doctor, with your primary care doctor. You can schedule a visit specifically for a flu shot, but you can also get them at, you know, I think there's some drugstores that offer. They don't have to be administered specifically at your doctor's office. So you can find a place that's convenient for you to get those done, right? I think.
Yes.
Right. And also a lot of employers will do it, like they'll have the day in the office because they understand how important this is. So they'll do.
And for another just question there, and if there's a financial barrier, there are also, I'm assuming there are resources for people to receive free or low cost flu vaccines. Yeah. Let's, you know, sort of, that's so interesting what you said about the flu virus and the coronavirus. They are not the same, right? So a flu shot is not going to be something that would protect you potentially from the coronavirus and vice versa. So, but they have similar, can you talk to me a little bit about what their similar symptoms are, why they might present similarly,
Sure.
Just that kind of thing.
Well, so this is going to be the challenge that we will have in the fall, where both conditions can present with high fevers and muscle aches and cough and shortness of breath. You know, sometimes what we would see with coronavirus is often your symptoms can get worse a week later. So this is going to be a challenge because a lot of the signs and symptoms can be very similar. So as much as possible, please do get that flu vaccine. I've seen them advertised, you know, for people without health insurance, $20, $30, save a couple of lattes and just get that flu vaccine.
Right. And we shouldn't make any assumptions. If you have any of those symptoms, you shouldn't say, oh, it's probably just the flu or probably just a cold. We should probably all be erring on the side of super caution, and for our both protection. That's really, this has been so enlightening for me. I hope it was also interesting for all of our viewers and for you guys too. We have a few more questions, and then I think we're gonna wrap it up. And then I would love to leave the floor open to you guys if there's something you feel like we haven't covered. So you'll feel free. The last question is, someone asked, we're doing protection again. So someone wants to know about face shields versus masks. Are they one and the same? Is it a combination of both? What should we be doing as far as that's concerned?
Yeah, so face shields are complementary to masks. There's an idea that came about a little bit later in the pandemic, that eye protection is important, that for some people, probably the eyes is the portal of entry for the virus. And so your mask is going to cover your mouth and your nose, obviously, which is probably the biggest portal of entry. But if you want an additional layer of protection, the face shield is intended to protect your eyes.
Oh, great. So face shield for the eyes, but that means you still need to be wearing a mask.
A mask.
That's really
is actually the number one primary. And then, you can do a face shield on top of it. And I see one of the other questions are about like hair salons and nail salons.
Right.
And actually, Paul, I'll do this one. Actually,
Paul's got good looking hair, so I don't know.
You must have gone to the salon recently or something. But I've noticed that hair salons and nail salons, what they've been doing is these shields protecting your little area from the person next to you, and then requiring a mask and having people socially distance, where normally somebody would be getting their pedicure maybe 2 feet away. Then now they are 6 to 8 feet away at in every other chair situation. So that's a situation where I actually have seen hairstylists and nail technicians actually wearing masks and face shields as well.
Great.
Yeah,
I'm open an outdoor salon, right, Paul? Maybe that's where Paul gets his haircut, an outdoor salon, right in the park.
Maybe.
So outdoor salons is a fantastic idea in terms of being creative and finding ways to, to do what you need to do in the safest setting. I was going to say, just going back to the nail salons. So when you're trying to evaluate whether or not you should do something, it's always a question of what's the risk, but also what's the reward. So, at a particular moment in time, right now, thank God, again, the prevalence is low and there's a lot of things that could be done safely. But when there's an uptick in the virus, going to a doctor's office might still be the right thing to do. It's a little more dangerous because there's more virus. The doctor's probably going to take more preventive measures, but also the reward is greater. It's something that you need to do. But going to a nail salon when the prevalence goes up, even if the risk gets a little bit bigger, maybe the reward is, well, maybe I shouldn't say this, but for me, the reward seems like it's not that important when the risk starts to go up. So it's a question of sort of what are your risks and what are you getting out of it?
I have to remember to nail that next time I see Paul.
In the vein of everybody learning, pivoting, and figuring out, changing, improvising, I've learned to get very good at doing my own nails, and trimming my own brows. And I feel as though I don't need to pay anyone ever again for those services. I am becoming an expert.
You look fabulous.
Thanks. This has been really, really illuminating and amazing. I would love to leave the floor open for you guys if you want to add anything else that you feel like we haven't covered, talk to our viewers directly, and then we will sign off and say so long.
So I did notice that someone had a question, and this will go into my wrap up, about has quarantining for 5+ months resulted in the rise of particular medical issues? You've heard of the COVID-19, the 19 pounds that people have gained during this period. So we have seen people be more, at home, frankly, and not be moving as much, especially as New Yorkers. We're used to moving. So there has been an issue with that. Also, stress-related issues. Yeah. So just to talk a little bit about the diet, first of all, there are tremendous exercises that you can do in your home that are available online. It's really essential to keep active. It's important for your mental health, for your physical health. And I think that's, if this is going on for a while, I think people have to realize that gyms might not be open immediately. And, maybe you want to invest in, a couple of big cans of garbanzo beans to do some of those exercises at home. So just kind of improvise, but make sure you're active. Also, mental health issues. The stress is really hard. There's a lot of anxiety, a lot of depression. We can get through this. Our parents got through worse, and our grandparents, went through even worse than this. Please limit the amount that you're watching the news. Stay positive. reach out to your primary doctor, reach out to your friends, and know that, this too shall pass.
That's really an amazing thing to say. Thank you so much for sharing that. Dr. Fenyves?
Yeah.
Any last words?
Sure, Moitri, that was really fantastic. And so I'm just going to echo what she said and build on it just a little bit in terms of, the question about the 5 months of quarantining. So many people we know have delayed care, and there's a big concern in the medical community that there's going to be a secondary epidemic of delayed diagnoses. So, obviously with things like cancer, an earlier diagnosis generally implies a better prognosis. And there are, unfortunately, we know many people who have been delaying their care, understandably so because of this pandemic. But it's a really unfortunate thing to think that some of those people will get a diagnosis later in the course of their illness and will suffer a worse outcome because of that. So, this is a huge plug for right now. If you don't have a primary care doctor, find one. There's some great ones at Weill Cornell. We'd love to see you. If you do have one, go see them. Get your checkup. If you have any problems that have been nagging you and you've been scared to come to the doctor's office, now is the time to come. Now is a safe time, and get the care you need, please.
Yeah. That's incredible. This has been great. I've said that a few times. It really has been. This is Healthcare Heroes, Playbill.com, and Weill Cornell. And I will add, in addition to loving Playbill, Weill Cornell is the location of many of my important doctors. I see an otolaryngologist there who performed this vocal surgery on me a couple years ago. Both of my beloved nephews were born in that hospital. And my older nephew received, a really life-saving kidney transplant surgery at Weill Cornell. I can attest to the professionalism, the kindness, and the beauty of that facility, and every single doctor who I have encountered at that medical center. So they're all over New York City. These are two great primary care physicians. So if anybody out there is looking for someone, I don't know how busy your books are, but I'm sure you can reach out to Weill Cornell, reach out to your own primary care doctor, ask your friends, make an appointment, and take care of yourself. So thanks, everyone. Thanks, Moitri. Thanks, Paul. We appreciate your time so very much.
Thank you so much,
Nikki.